Dr. Diane Gabriel has a practice in homeopathic medicine, acupuncture. She practices at 5 different hospitals around the New Jersey, Pennsylvania area, including Ann Emerge up here in Somerville.
Thank you.
Thanks, Pizazz, for having me here today. First part of the lecture, I'm just going to introduce veterinary acupuncture to you, and then at the latter half, I'm just going to compare a couple cases of conventional versus like an integrative approach to veterinary medicine, okay? All right, veterinary acupuncture, it's a natural healing aid. What is it? It's the stimulation of special points on the body, acupuncture points, using very fine needles. You can also use lasers and other devices to stimulate the acupuncture points, but the whole point is to just elicit a desired effect. So the special points are the acupuncture points, or the acupoints, lie along channels or meridians that span the entire body of animals and people. There's 12 channels and over 100 acupuncture points that lie along them. In Chinese theory, this is all based on Chinese theory, each meridian is named for an organ that it represents. Pathology, or meaning pain or inflammation, along a meridian or within an acupuncture point can represent a local area of inflammation or potentially a systemic problem. A typical acupuncture treatment may use as few as 1 to as many as 20 or more acupuncture points per session. Okay, here's a diagram of some of the channels, meridians, and the acupuncture points. So the lines are the actual meridians or channels, and you can see they're color-coded and are coded, named appropriately for whatever organ it's running along or named for. It's not always running along or over that organ, but typically it does. And the dots with the numbers are the individual acupuncture points, okay? So what you can see from this diagram is that there are a lot of different acupuncture points. They do span the entire body, and I have a couple more views. We'll get to those slides. But some of the meridians concentrate on the head and front legs, the front of the body, okay? Like the lung and large intestine meridian. The lung meridian runs right inside the front arm to the front of the chest here. And then you'll have like a large intestine meridian, obviously not anywhere near the large intestine, but again, this is Chinese theory, starting at the side of the nostril and running all the way down to the tip of the toes. In veterinary acupuncture, I use this lung meridian a lot for wrist problems, carpus problems, right? And the large intestine meridian is useful, it runs right alongside this arm, front arm, and elbow, so a lot of elbow dysplasia, things like that. The large intestine meridian also has some points on it that help stimulate the immune system. Another interesting point about this slide is that you can see the stomach channel, right? Here's one in yellow that spans the entire body. It starts at the front of the face, around the eye, and comes around down and ends on the back toe of the dog. We can also see the liver meridian. We'll get another view on another slide. It runs on the inside of the back leg, starts about midsection of the dog and runs along the inside back leg of the animal. So, and then we'll have some other, the bladder meridian, which I'll show you on the next slide, I think, runs along the entire dorsum of the dog, and that's a especially helpful meridian with acupuncture points along it in animal acupuncture. Okay, so this is the dog on the back. The next slide will show the bladder meridian, which is on the back of the dog. But here's some meridians that are shown. The midsection here is the conception vessel. Again, we can see a good view here of the stomach meridian. And also we see the liver meridian with its acupuncture points along it. Here's part of the kidney meridian. See how it circles around the inside of the hock here, or the ankle? That's a really good point for pain control in general in the animal. They used to call it the aspirin point, but they don't typically like to call it that anymore. That's kidney 3 there. It's excellent for arthritis in the back leg, especially the lower extremity. Okay, so here's the slide I was getting to. The most utilized meridian and acupuncture points in veterinary medicine are along the bladder meridian, okay? Starts at the front of the face around the eye, goes alongside of the vertebrae. It's actually the epaxial muscles, kind of like the tenderloin, right? And ends on the back foot. Why is it utilized so much? Well, a lot of these bladder points are association points with certain organs in the body. So if I have a dog or cat in renal failure, kidney failure, I will also needle the association point to help tonify the kidney on the bladder meridian. Okay. They also have an association point for the heart, for the lungs, for the diaphragm. So it's very useful for that. The other thing is it's easily accessible, right? It's on the dorsum of the dog. The dog will be standing or laying down, so it's easy for us to get to and needle the dog. It's very helpful in that respect. Also hugely used in any kind of disc disease or herniated disc problems. If a dog has a disc injury between the thoracic and lumbar vertebrae, which is like the most common area, I'll put needles in front and behind the lesion, and usually we use electroacupuncture for that. Another hugely popular meridian in animals is the gallbladder meridian. Again, it spans the entire body. It starts at around the head and face, whips around the masseter, goes behind the ears, tucks behind the ears, goes to the shoulder, across the body, then circles around the hips. So can you imagine it's used a lot in hip dysplasia? Okay, and then it also circles around the knee. So it's good for any kind of cruciate, stifle, knee injuries. It also has association points or special points for ligaments in the body. So gallbladder 34, for instance, is a special point just for any kind of ligament tear or problem in the body. So not just a ligament in the knee, it could be a ligament issue or kind of a pull anywhere in the body.